Whether you're on Medicare yourself or somebody that you know and care about is on Medicare, it's important we all keep up with the changes that are coming to Medicare because that program is just so enormously important for so many Americans. And to share the changes that are coming up, I'm going to use an article by AARP. It's called Seven Changes Coming to Medicare in 2026. And the first one I want to talk about from the article is Medicare Advantage plans are going to have to limit their non-medical benefits. Now, almost half of us, or I think actually it just passed last year, more than half of seniors, it's right at 50%, are on Medicare Advantage plans. And one of the things seniors like about is it includes other benefits, oftentimes like a health club membership, maybe dental, maybe eye care, glasses, contact lenses, stuff like that. But some of these benefits are being cut back. And among the benefits and treatments that will not be allowed in 2026, the first one I had to laugh at, I don't know if any plans had this, but they can no longer include alcohol, cannabis, or tobacco products. Certain cosmetic surgeries and procedures such as facelift treatment for facial lines and remedies for atrophy of collagen and fat, also funeral planning and expenses, life insurance and hospital indemnity insurance, and unhealthy foods. So all of those things can no longer be covered on Medicare Advantage plans. Okay, this is a big change, the next one, number 2 that I'm talking about. And right now, if you're on a original Medicare, not a Medicare Advantage plan, there's no prior authorization needed for you to get treatments. And starting next year, there's going to be a 6-year experiment that Medicare is running where millions of original Medicare beneficiaries in 6 states could be required to get advanced approval called prior authorization before certain medical procedures or devices are covered. Now, why are they doing that? The article says this program's designed to speed up coverage decisions and, importantly, cut wasteful spending on at least 16 devices, procedures, and services that are particularly vulnerable to fraud, waste, abuse, or inappropriate use. So I think there was a lot of fraud in these cases that they're looking for prior authorization now. Um, and as I mentioned, the test is going to run for several years, and it's going to cover 6 states, and those 6 states are Arizona or parts of these states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. And who knows, if that program's successful, maybe they roll it out nationwide. Okay, another change is some enrollees may get another chance to switch plans. As I record this video, the United States is in what's called the annual enrollment period, AEP, which in 2025 is running October 15th to December 7th. But some people are going to get a second bite of the apple because it's really important when you sign up for a plan and you think you're going to get access to certain doctors, certain hospitals, that you actually do get that access. And here's what the article says. If a Medicare Advantage enrollee who used Plan Finder, which is a service by Medicare, during their first 3 months on a plan discovers that the information was wrong and their doctors are not in network, they'll be able to switch to a plan that has their providers or go to original Medicare during and only in 2026 special enrollment period. So talk to a specialist to know whether this is going to cover you or not. In fact, every year, I think it's important that Medicare is so important to us, whether it's yourself or somebody that you know and love. It's super important that we all check and make sure that the plan we're on this year is the right plan for us next year, which is why I'm proud to partner with this video sponsor, Chapter. Chapter is a Medicare advisor, and I agreed to partner with them for 3 main reasons. The first is that their services are free to you and I. There's really no reason to not use a Medicare specialist. The second reason is Chapter's average client saves $1,100 a year. And the third reason, and this one's the most important one to me, which is if you are on the right plan for you, this year you call them up and say, this is the plan I'm on. If it's the right plan for you for 2026, they're going to tell you that. And that's what you want. You want somebody that has expertise, that had access to the correct information that's going to tell you what's best for you. I believe that's Chapter. You can sign up for them here. Pro tip, they're about to get busy. You can also sign up with them by calling their phone number. Okay, let's keep going. The next change, and this is deductibles and spending caps for Part D, which is our prescription drugs. Those plans are going to go up. They're going to go up to a $2,100 cap in 2026, and that was a $2,000 cap in 2025. And then the maximum deductible is going to increase to $615, and that's up from $590. Okay, now for some really good news. There's some very expensive drugs, and Medicare has negotiated lower drug prices for 10 prescription drugs. And this is a list of what those drugs are. This is for a 30-day supply. And you can see some of these drugs, one of them was $15,000 a month. And that's being lowered down to almost $9,000. But you can see some of these changes are quite significant. So good job negotiating lower prices. I personally hope that continues. Particularly for Medicare beneficiaries, I think it's super important. You can see all of this is complicated, so it's important that we plan not just for our healthcare costs, but our other costs, and we have a plan and we do what if scenarios. And unfortunately, only 1 in 4 of us in the United States have a written financial plan. I'd like to see that number be 99.99%. I urge you to have a financial plan. The gold standard is to work with a financial advisor. If you prefer to do it yourself, use software designed for you. The software that I like is called Bolden. It used to be called New Retirement, but it's powerful. It's easy to use and it's affordable. There's no reason not to use it. You can sign up using this link here and you'll be supporting the channel. I am an affiliate. Okay, let's keep going with this AARP article. The next one is there's no need to re-enroll in Medicare the drug payment plan. Now you want to double check on this. This is what AARP is saying. To make enrollment in the program easier in 2026, those who participated in 2025 will be re-enrolled automatically unless they opt out or change to a new Part D or a Medicare Advantage plan. Double check on that because you don't want to be in a situation where you don't have prescription drug coverage if that's what you want. Okay, the next one is Medicare is going to shutter their supplemental benefit pilot program. This was a program that targeted low-income beneficiaries, including people that were qualified for Medicare and Medicaid. And the reason they're shutting it down was it was a high cost. It cost $2.3 billion in 2021 and $2.2 billion in 2022. So that pilot plan is being shut down. I think it's great that Medicare continues to experiment with different things and that they're lowering prescription costs for some of the most expensive drugs. If you like this video, a couple things. If you've made it this far, don't sign off yet. If you made it this far, give my video a thumbs up. Think about subscribing. And also, my best ideas are in my newsletter. So think about signing up for my newsletter. My clients used to pay thousands of dollars for my insights, and I'm giving it all away free here on my YouTube channel and in my newsletter. And finally, a super important decision. We talked about Medicare. We talked about planning. Another important decision is when you decide to retire, and it's why I made this video here. Why waiting to 65 to retire might be a big mistake. Thanks for watching this video. Bye-bye.